first thing that a patient would notice when they came to see me would be that I try really, really, really hard to get them in a room and seen on time. That's not always the case with a busy practice sometimes, but in my practice it is. I'm always watching the clock, watching what time people are supposed to be arriving, and I'm very careful about trying to get them in on time. I'm not perfect. I can't plan for everything. Sometimes people need a little extra time in the room. Sometimes an urgent issue comes up that you need to work with, but I try very hard to make that happen. People's time is very important. People are worried about getting home, getting the kids off the bus. They're taking time off for work. Family members have taken time off to come in with them. So I think it's very important that I respect their time and try and get them in a room on time. Plus, they're nervous. It doesn't matter if it's cancer. It doesn't matter if it turns out not to be cancer. By definition, when you're seeing a breast surgeon, you're very scared. And nothing worse than showing up for that 2 o'clock appointment and then sitting and getting more and more and more scared. And I don't want that to happen to my patients. So I try very hard to get them in a room on time. I also try very hard to look through their history and their films and things so that I know about them before I go in the room, so that our time in the room is spent talking about them, how this came to happen, how they're feeling about things, the things that are important to them, and can help come up with a plan that they feel good about. And so I want that time to be about them. So I try and prepare so that we don't waste time going through things that are in the medical record. We just spend time with that patient when we're in the room.